to this. I wish we had a bit more time. There's so much great discussion happening this morning. I was getting so excited about hearing that the problems that people are finding in the field are the problems that we've identified, and underscoring that those are the biggest challenges. So if I had more time, I'd be telling you more stuff about how we have been worried about this space problem at home in the bathrooms, and how we're developing a product that will allow you to maybe shift the position of the toilet so you can let people use their walkers and let caregivers get in and support toileting. Or footwear, falls for home care workers going in and getting to people's homes and out, just like winter tires have a little labeling system on them. Wouldn't it be great if footwear had a little symbol on it that told you that it worked on ice using our testing facility at Toronto Rehab? So we call this Winter Lab, where you can have people walking on an ice surface with whatever pair of shoes you want, and the angle that you're able to climb to defines how well that footwear works. Unfortunately, right now, if you get a pair of footwear, you go into the store and you look at the bottom and you say, oh, that looks like it's going to have really good grip. I guarantee you there's no link between what it looks like and how well it works. It all has to do with the material properties of that rubber that's on there, and there hasn't been much thought put into that or testing that. So if we had more time, we could talk about that a bit more, but for now, I'll move on. Grab bars, so the link between fall prevention in clients and patients and back injury prevention. Where should we put grab bars so that we don't have, if there's a slip in a bathtub and people are moving in and out of tubs, how do they safely how can we keep them safe from hurting themselves? How can we keep the caregiver in that case safe when they run in to try to catch them, right? All stuff that we're working on that we won't have time to talk about today. Here's the doom and gloom that we started with today, right? We have double the rates of injuries in nurses compared to mining. Let's look more at hope, though. I think in this field we've done a lot. We've moved a long way, right? We've gone from all manual lifting activities. We've recognized that these manual lifting activities are dangerous and that they result in injuries. We've moved to patient lift devices. So the big question is, why are we still seeing such high rates of injuries? Well, we think there's two major reasons. One is, just because you put up a lift doesn't mean people will use it. The second is, some of the equipment that we give people doesn't actually reduce the loading as much as we hoped it would. We know that floor lifts, the amount of force required to push and turn a floor lift is way above what's considered a safe limit. This is work by Bill Maris. So overhead lifts are much better, but of course you can't have overhead lifts everywhere. You can't have track everywhere, so we need to think of a better way to deal with lifting in corridors and in spaces where you don't have overhead lifts. Getting slings under people, no matter what type of lift you have, getting slings under people, you're over what we consider a safe limit for compression on the spine when you're even just rolling a 200-pound patient on a bed, whether you have one or two people doing that activity. So what can we do there? We'll show you some of the tools that we're trying to develop that will address these issues. So today I'm going to talk about 5 products that we've worked on. 2 are coaching tools, and 3 are tools to reduce physical loading with patient handling. The first and the last are products that are actually on the market. The other ones in the middle are things that we're still developing as we go. We've spent a lot of time thinking about, as many of the groups today, many of the case presentations have done, thinking about the most effective way to get healthcare workers intuitive understandings of what's happening, how back injuries happen, how they can be prevented, and motivating them to use that knowledge on a day-to-day basis, right? The challenge is, as I think Cindy said, it has to be simple. It has to be super simple. It has to be distilled right down to key points. How do you do that effectively? I think we use a lot of pictures. We've taken a stab at this. We put up our materials on preventbackinjury.org, giving people a little bit of anatomy. Most back injuries happen in the low back. The spine, as I mentioned earlier this morning, can actually support a lot of load. You can put 750 pounds of compression force on the spine. Well, why is it then that we see so many back injuries? Well, it's because of the way the body supports these loads, right? We have to find intuitive ways to let people understand what's happening when you go to bend over a bed and you're reaching across the bed. And in a home care situation, it's a queen bed and the person's far away from you on the wall side of the bed, let's say, and they're reaching to roll them over. What's happening there? It's not the weight that you're lifting in your hands that's the critical piece. It's the fact that that's so far away from you. You've got your upper body mass that's bent over, that you've bent over, so you're balancing that. And all of that's being balanced on this really, really off-balance teeter-totter, right? Where the balance point is really your spine, is the vertebrae and the intervertebral discs of your spine. All the weight of what you're lifting plus what's balancing all that load in your spine is the back muscles, is your erector spinae muscles that have to pull down like crazy because they're working on this tiny little moment arm on that one end. When you add up the force of the back muscles and the upper body weight and what you're lifting, you see that very quickly, lifting fairly moderate loads, you end up with these huge forces acting on your spine, right? And so we've developed, trying to give people, we're trying to think about what are the best ways to give people an intuitive understanding of how that's happening. So we developed an app that's really, it's based on Wattback, which is a product that came out of University of Waterloo. Stu McGill developed it, a program where you can pose little models and then estimate what the loads are on the spine. We've developed an app version. This is free. You can download it now. It's called SafeBack. Take a picture of someone in a pose. You use the little sliders at the bottom to pose the model in whatever posture they're in, and this thing will tell you whether it's a safe or unsafe activity. So does that help get an intuitive understanding of how people are moving when they're actually doing things? St. Elizabeth Healthcare, Ken I think is here from St. Elizabeth, they work closely with us. One of their physiotherapists who does a lot of the training with their PSWs is testing this out, incorporating it in with their training programs to see if it's beneficial. So again, knowing that how to do something and actually using that knowledge in the field are two different things, and it's difficult to get from one place to another. We all know, I think the example was speeding. We all know we probably shouldn't speed, but we do. We all know we probably need to floss every night, but not all of us do. How do you do it in the moment when you're actually in the field? You have to bend. If it turns out you have to bend, how do you, what else can you do? Because a lot of these challenges, especially at home, require people to bend. It's really, and if you talk to PSWs and tell them don't bend, they'll tell you you're crazy because you can't do these jobs without bending. But at least what we're hoping is that you get at least an intuitive understanding of why you're trying to keep the loads close to your body and why it's important to try to stay as straight as you can. If you have to bend, the other piece of knowledge or kind of guidance we're trying to get people to understand is that you want to keep the curve in your low back when you're bending over. If you have to bend, try to bend by sticking your bum out. What that does is so the picture on the left, you can see how when you're bent over and you're keeping the curve in your low back, the picture on the bottom left shows that the facet joints of the spine are locked together. So the piece at the back of the spine, do I have a pointer here? See, no, I don't have a pointer. So you're locking together the bones along the back of the spine. What that means is you're sharing the load across the disc as well as the bone. So now you have a larger surface area over which that load is acting, lower chance of having some sort of injury building up. And the converse is if you arch, if you flex your spine, as in the picture on the right, on the bottom right you see how all of the load is now concentrated on the disc, on the front of the disc. So you're trying to avoid that, you're trying to do what's on the left, right? So how do you can we provide people an intuitive way of making use of this in the field? Again, it's difficult when you're washing someone, you're bathing someone in a tub. How do you remember to do this on the spot? That's the key question, right? So we've developed a tool called Posture Coach. It incorporates two sensors, one that's on the top of the spine, one that's on sort of upper back, one on the lower back. And as the person bends, we've set kind of arbitrary limits on what we think is considered how far you should be able to bend, keeping that curve in your low back, and how far you should be able to twist safely. This thing will basically vibrate. So it's designed the two sensors are designed to talk by Bluetooth to a smartphone that's in your pocket that will vibrate at you if you've bent too far. So that, again, we're testing out with St. Elizabeth to see whether that works. And I invite, I mean, it sounds like there's a lot of back care programs being developed across all of the different groups that are here now. Wouldn't it be interesting if we evaluated before and after a program to see if we actually see a change in behavior? So we could, I invite you to join me to try to do that. The other thing I'll just mention here, this is the line at the top here, are you spending your bending wisely, is something that Emily King, PhD candidate in our lab, came up with. I think it's brilliant. I think the idea here is not that the warning that you get, the vibration warning if you're bending or twisting too far, is not to say you should never do that, but to say that if you have to bend, you should keep in mind the more you bend, the more risk you're at. So start to sort of think about it as you have this allotted amount of bending that you can do, and every time you do some, you lose, you're paying out of an account or something. And so thinking about it in that respect, you try to avoid bending whenever possible. So if you have to lift someone's legs into a bed, rather than bend right over and lift their legs, maybe you try to use a towel wrapped around their ankle to lift it up. So just as much as possible to keep that at top of mind. I mentioned we'd love to collaborate with anyone that wants to use any of these tools to evaluate your programs or to build on programs or see if we can find a way to incorporate programs together. I don't know if anyone's interested, come talk to me after. The problem, of course, is biomechanics or body mechanics and training only goes so far. We know that manual lifting is unsafe if you're lifting someone's full body weight or close to someone's full body weight. If you're trying to lift them out of a bed into a wheelchair, even with two people, you're way above what's considered a safe limit, and you're going to develop injuries as a result of that. Not everyone, but a large part of your workforce will develop injuries as a result of that. I should say, again, it's a bell curve where some people, there's that part of the bell curve that will get injured. So we do need equipment. And more we're using equipment to lift things. So we've got the floor lifts and the overhead lifts that take that compressive load off the spine. We're also now recognizing with the floor lift, pushing a floor lift, now the shear loading on the spine is too much. So what we talk about, it's a much lower load now that you're talking about in the shear direction when you're pushing on something. And in healthcare, we've already started to address this problem. We've recognized that pushing a bed or pushing a wheelchair for too long, you get that same shear loading, and so we've started to develop powered devices to drive these things, powered moving devices. But we still also sell floor lifts like this that are made for 1,000-pound patients that weigh, so the lift itself weighs 400 pounds. So you're talking, 1,400 pounds is like trying to do a three-point turn with a smart car with your bare hands, right? That's what you're talking about doing. So some of these tools are just not effective. And so if this is, we have to do a better job of designing tools that actually reduce the loading on people to a safe level. So our team has been working on a device, we call it RoboNurse. This is a previous version. I can't show you the latest version because it hasn't been fully patent protected yet. But the idea is that it's a powered device that you drive around, similar to the bed movers, but this is now a floor lift device to address the problem that you can't always have a ceiling lift wherever you need it. The other problem I mentioned earlier was regardless of what type of lift you have, you need to get a sling under the person before you can lift them with the lift. That activity itself, particularly if you're talking about a 300 or 400 pound person, again, rolling that person is really challenging. We've developed this thing called Slingserter that lets you get lifting straps under someone without any effort at all. So in that plastic cartridge is a tube that you inflate with air, and it shoots a bunch of tubes under people. Depending on the size and the amount of comfort you want to provide in a particular case, you would shoot as however many of those you want underneath the person. We haven't yet found a limit for the weight of the person that these can go under. The idea is then you can lift the person just a few inches off the bed with these straps, quickly put your sling in, and do whatever you need to do from there on in. A lot of daily nursing tasks we think could could be supported with a simple lift like that, where you just lift someone, you don't even need a sling, you just lift them a few inches off the bed, you can change sheets, you can put a bedpan in, you can reposition people. So the product is not yet on the market. Our commercial partner, we're really excited that they're getting there. It's taking longer than we'd hoped, but it will hopefully soon get on the market and make getting slings under people easier. The last product I'll tell you about is, it has to do with this balance of, I think Matt said it, right? The human Saskapole. So we don't want people to be a human Saskapole. There's the obvious risk of someone falling and you having to catch them, but there's also just the extra load on the healthcare worker in that scenario, right? If you can find a way to get someone to independently transfer if you give them a pole, you've offloaded so much risk and workload. So we've developed a couple of products to support that. One that's designed to address the problem of Saskapoles in a healthcare environment where you have a false ceiling, right? If you have a drop ceiling, you can't use these. For those who don't know what a Saskapole is, it's a pole that you put in place and you tighten a nut at the top and it expands between the ceiling and the floor and holds itself in place very rigidly. You would put that next to the bed so the person could use that to pull themselves up out of bed. In nursing homes and hospitals, often you don't have the ability to put in a Saskapole. What you can do, what we've developed, is a product we call Stand Easy, and it mounts to a set of tracks on the wall behind the bed. So we think that should be sort of standard issue for new hospitals getting put in, or even existing hospitals. There should be tracks put in by every bed. And when you have a patient that has a balance problem and might benefit from one of these poles, you would just quickly snap the pole in place. So here's a video of a gentleman who I talked to just on last week. I think it was Thursday of last week, and he's someone he's had a stroke. And he was raving about how great this pole was. He's someone who originally from Parry Sound. His hospital in Parry Sound didn't have one of these, and it meant that he had healthcare. He either had a healthcare worker come to lift him out, and he wasn't he wasn't as active as he is now, because he's able to come and go as he wants now. He doesn't have to wait for someone to come take him out of bed. And the huge benefit to that. He was also very interested in the home version of that product, which is more like the traditional Saskapole, where you just have these poles that are pressure fit between the ceiling and the floor. But we have the added benefit of snapping on horizontal pieces, sort of like a Lego system. So you can quickly create a path that leads someone from the bedroom to the bathroom. So again, someone with a little bit of balance problems can now independently get themselves from one place to another in the house. Get on and off the toilet independently, get in and out of the shower independently. Once Emily and Allison figure out what the best location for grab bars are in the bathroom and get them put into our building codes, we can then install these poles in the right places next to the tub so that people can safely get themselves in and out. And I guess that's the last point I wanted to make, is that I think there is an important balance between the healthcare worker safety and the client health and safety, and I think these things go together really closely. If you can find a way to help someone be independent, we know that the reason, we all talk about, I'm sure people in this room are familiar with the problem of falls in older adults and in patients. The reason falls are so devastating is because people end up laid up in bed for a long time after the fall, and so they start to deteriorate, their muscles, their cardiovascular system and their muscles start to deteriorate. Well, you get the same effect if people are left in bed because they need to wait for a healthcare worker to come and help them out. The difference, it seems simple, but putting a pole next to someone's bed is a huge difference to their health and their trajectory as they rehabilitate or they're cared for. Because they can independently get up and down, that means that they will move more, and so they'll be healthier. So there's this link, I think, that we need to explore more in terms of supporting patients and offloading caregivers. That's our website if you're interested in more of the projects and products that we're working on there. And my email address is there. I'm happy to chat with people after. Thanks, everyone.